A comprehensive strategy or approach in preventing mother-to-child transmission of HIV infection is, first of all, to make sure that no woman or no pregnant woman even contracts the disease. Now, if a woman has contracted the disease, then we want to focus on making sure that this woman does not pass on the infection to her unborn child. And to do this, we do have strategies which we call the prevention of mother-to-child transmitted strategies to be able to reduce or even prevent an unborn child from contracting the disease from its mother. Some of the things that we do in our hospitals is to make sure that every pregnant woman who comes into our institution for antenatal care is counseled and offered to have HIV testing. And when the woman is found to be positive, she is offered antiretrovirals either as treatment, depending on her eligibility for treatment, or as prophylaxis to be able to help the viral load to come down so that she will not transmit the infection to her baby. Then apart from that, when she has come to deliver, during labor and delivery, we also put in interventions so that we are not unduly making the baby come into contact with her mother's infected fluids, and in that way we are able to prevent the baby from getting the infection. Finally, of major importance is breastfeeding, because we do have problems with stigmatization. So the decision as to whether to breastfeed or not to breastfeed is a major concern for our mothers. So we do counsel them on that issue as well.
The HIV and infant feeding policy being implemented by the Ghana Health Service and the Ministry of Health now is based on the findings that the amount of virus is drastically reduced when the mother is put on antiretroviral drugs. As a result of this, when mothers come for antenatal at 14 weeks, they are put on the antiretroviral drugs, and these mothers could be mothers who are already on the drugs or those who are put on it for a short term. The policy continues that the HIV positive mothers who have been put on the drugs already, when they deliver, should exclusively breastfeed their babies until the babies are 6 months old, and then they can add complementary foods to the breast milk until the babies are 1 year old, that is 12 months old. The mother then stops taking the drug when a month later, that is when their babies are 13 months old. The policy also recognizes a few mothers who insist that they do not want to breastfeed at all. In this situation, we have counselors in our health facility who will counsel them on the option that they want to give to the baby. They counsel them on affordability of the breast milk substitutes, whether they can afford it. They also counsel them on hygienic preparation and safe preparation of the formula, and acceptability of that option to the whole family so that she does not face a problem. This is because some mothers may not want to take the risk at all, because they may not believe that the virus will still not go through their breast milk, even when they are on the drugs.
The program for prevention of mother-to-child transmission of HIV started in 2003. At that time, we were giving 1 tablet to the pregnant woman in labor called nevirapine. And then the child took a week's course of medication. In 2007, we had a better option of combining 2 tablets, given to the woman from 7 months or 28 weeks through delivery, and a week's course for the child. Then come last year, 2010, WHO and the global world, based on newer scientific evidence, changed this arrangement. And now our new guidelines specify that any pregnant woman who is HIV positive must be provided prophylaxis. Prophylaxis is medicine to prevent transmission from mother to child. So the woman takes this because of the child, not because of herself. And there are ways we determine whether the woman should go on treatment for her own right, or we provide the medicines because of the child. This starts from about 3 months, 14 weeks. She will take it throughout pregnancy, delivery, and continue for 1 year minimum after delivery. The aim is to substantially reduce transmission to the child. And if you take this medication as advised, then the probability of you passing the virus on to your child is drastically reduced. If you take every 100 women who go through this process, less than 5 would ever pass the virus on to the child. So that is a better option. That is what is used in the developed world, and Ghana has opted to use that medicine.
Nguya lama wali su nguya vuyiga lor HIV kun kuri ana zagento ai HIV positive mu sanyore di lirbia kwem di kapendi bara na kana embe kwe roba ka penne HIV kun wali ntete sin chintete sin vuni jana kanini nji HIV kun na ambajiga sin nguyi kan lama